Congestive heart failure occurs when the heart is unable to pump blood effectively, leading to fluid buildup in the body. There are several key causes of this condition. First, coronary artery disease is one of the most common causes where narrowed or blocked arteries reduce blood flow to the heart muscles. High blood pressure also plays a significant role as it forces the heart to work harder, causing it to weaken over time. Another cause is heart valve disease, where damaged valves affect the heart's ability to circulate blood properly. Additionally, cardiomyopathy, which refers to the weakening or thickening of the heart muscle, can contribute to CHF. Lifestyle factors such as excessive alcohol consumption, obesity, and smoking can also increase the risk. Lastly, other conditions like diabetes, infections, and thyroid problems can also affect heart function.